All right, let's talk now to Dr. Shalina Babul. She is a sports injury specialist as well as an associate director here at BC Children's Hospital. And she also is a clinical professor over at UBC. So a very busy woman who knows a thing or two about concussions. Thanks so much for being here.
Thank you for having me.
Yeah, so we reached out to our online community to see what their questions were about concussions. And we're going to ask them to Dr. Babul here today and get some answers for families across BC. So let's start with the first question.
Sure.
What is a concussion and what are its signs and symptoms?
So the brain is a very intricate, delicate organ that has millions and millions of nerve fibers. So when there is an impact to the head or another part of the body, results in an acceleration or a deceleration or rotation of the head, causing your brain to bounce around, you get a functional or a structural change to the brain that needs time to heal. And as a result of that, you see the signs and symptoms. Some of those include headache, feeling foggy, confused, sensitivity to light, sensitivity to noise, feeling sleepy, those kinds of things.
A number of symptoms, absolutely. Yeah. Another question from some families across BC. How do we know when a concussion is serious enough to go to the emergency room?
So when there's an impact significant enough that you think the brain has bounced around inside the skull, you need to assess for red flags. So has there been loss of consciousness? Is the individual seizing? Do they have a severe headache, numbness and tingling? All those, if any of those are present, call 911 immediately.
Good advice. The third question is, how long do we have to keep an eye on someone after a concussion?
That's an excellent question, because a lot of times when there's an impact and someone's taken off the field or the ice rink, they're asked a few questions and they're put back to play. Signs and symptoms can appear subtly up to 48 hours later. So it's imperative that you monitor and keep an eye on that individual to make sure that signs and symptoms don't subtly appear.
Absolutely. And speaking of signs and symptoms, do mild concussions add up to affect you later in life?
Oh, that's a wonderful question, and we get asked that all the time. So every concussion is to be dealt with on a case-by-case basis. No two concussions are alike. A colleague of mine coins it like a snowflake. And there's a lot of situations and things to consider. How many concussions has the individual had? What were the signs and symptoms? How long did it take to recover? Were they participating in high-risk activities? So someone who participates in high-risk activities where there's repetitive head trauma, likely that will result in long-term consequences.
Okay. So a lot of factors at play there. And for anyone looking for more resources, you can go to www.catonline.com.